Today we're going to talk about a topic that affects millions of women dealing with pelvic organ prolapse and having the symptoms of that pressure or heaviness down in the vaginal area, just feeling uncomfortable and fearful about what's next. But there's lots of myths out there, and we're going to be busting some of those myths so you can actually overcome your fear and build more confidence in the fact that you're going to get over this, you're going to be fine, and you can actually ease your symptoms with some little known secrets that we will discuss today. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist, a women's health physical therapist, and after helping so many women with back pain, pelvic floor issues, anything related to the core and the pelvic floor, that's my specialty. And having women that are fearing pelvic organ prolapse symptoms, it can come with a lot of questions, especially if you go online and you start typing in your symptoms. You can really be scared by a lot of stuff out there, but there are a lot of myths attached with pelvic organ prolapse. So let's talk about those. Well, what is prolapse? Prolapse can happen to your bladder, your uterus, your rectum, where actually those pelvic muscles at the bottom part of your pelvis and your hips, they can weaken, and therefore it creates some distension of those organs toward the vaginal wall, creating symptoms of pressure, heaviness, sometimes lower back pain, sometimes lower abdominal pain or discomfort, and even feeling like or seeing a bulge through the vaginal or rectal area. But have no fear. This does not mean immediately you need to get surgery or that you have to rush to your doctor. There are 4 myths I'm going to go through today. So myth number 1, prolapse only happens to women as they're older. Older meaning like over the age of 70. Once you hit a certain age, it puts you more susceptible for having prolapse. Well, this is definitely not the case. I have worked with women that are younger, in their 30s, 40s, or even younger than that if they've had a baby or they also experienced something traumatic where they lifted really heavy weight and they put a lot of pressure or bear down, or they had a problem throughout their life where they're having a lot of constipation or digestive issues. All of this, putting a lot of stress and pressure on your pelvic floor, can create some of these symptoms. But it's not the myth is that it doesn't just happen to older women. You can develop some of these symptoms and start having some of these issues even if you haven't had a baby as well. So it's not just for older women, and it's not just a postpartum thing to worry about. But the biggest thing is that being aware, watching these types of videos, and knowing what to do to protect that area of your female body the best way when you are active or when you're lifting or straining and doing anything that's going to create a lot of manual effort and pressure around those muscles is going to be most important. So awareness is key, and you can prevent some of these symptoms from happening. So the second myth is exercises will make it worse. That is absolutely not true. I can't tell you the countless number of women that we have helped in person to be able to lift weights, do Pilates, do yoga, do things that normally would make their symptoms worse. But as long as you're learning the correct way to activate your pelvic floor and your core muscles, and also do breathing exercises properly with the lifting and with the movements, this is absolutely a game changer. My program, Pelvic Floor Pilates, actually talks you through that. So when you're done watching this video, go down in the description and I'll link to it there. But pelvic organ prolapse can be alleviated and helped. A lot of times the symptoms of it can be helped with the right types of exercises. You just need to learn from the expert. You need to learn from a professional like a pelvic floor expert that knows how to talk you through with the way to help those muscles control the support and create that support around your pelvic organs and around the vaginal wall, instead of creating more downward pressure and pressure against your abdominal wall and your pelvic floor. So lifting weights, one key tip is you want to be exhaling as you're lifting. Breathing out actually allows that pelvic floor to recoil and support the pelvic organs in a better manner. And I have other videos on this too of proper breathing exercises to do. But it is important if you are doing anything that is strenuous, or you're lifting a child out of the car or lifting heavy groceries, that you're exhaling when you do it. So it's syncing your breathing with the movements that is going to be the proper way to learn how to exercise with prolapse. Now, women ask all the time, can I be able to run? Can I be able to back squat or do power cleans with a prolapse? Yes, but there are other methods to help you. So visiting a pelvic floor physical therapist, or even looking into getting guidance by someone online that is a pelvic specialist, can talk you through the right thing to do so you can reach that goal. Okay, myth number 3, that surgery is your only option. Do not listen to the doctor if you've been to one doctor and they say, absolutely, you need surgery right away. That is false. If you have not done pelvic floor therapy, if you have not been fitted for a pessary, if you have not checked the boxes in all the holistic ways to help with the prolapse and ease the symptoms, do not jump into surgery. If your muscles aren't prepared enough to support a recovery and healing, therefore, it may not make your surgery as successful. So make sure that you're checking the boxes on all the holistic routes first before surgery, and also visit at least 2 doctors before you opt for a surgery. Many times surgery can be the very last option and is not the end-all be-all after being diagnosed with prolapse or having a prolapse, even at a stage 4. And lastly, myth number 4 is that prolapse means you're done with intimacy with your partner. That is absolutely false. A lot of women are fearful of having sex again and being intimate with their partner if they have a prolapse. But it absolutely, if you're seeing a pelvic floor specialist, this can be very helpful to talk through some strategies and ways to make you feel more confident and comfortable about it. But absolutely, you can still have intercourse. It is not, people a lot of time think it's the actual organ, but it's the vaginal wall that has pressure against it and therefore has collapsed and creating that extra pressure or bulge in the vaginal area. So your system is still working, it's still there, and you can still have intercourse. Don't fear that. I want to make sure that's very clear because we get this question a lot, and most women are afraid to talk about it with their doctor, but seeing someone like a pelvic floor specialist, a pelvic floor physical therapist that hears that question all the time, they're going to be able to put you at ease and talk you through some strategies to make you feel better about it. So I hope you found this video helpful about my top 4 myths about pelvic organ prolapse. There are a lot of other questions that come up, and I have some more helpful videos on this channel, so hit subscribe if you haven't already. And if you're interested in learning more about my pelvic floor Pilates program and how that can help you ease your symptoms of prolapse by lengthening and strengthening the pelvic floor and helping that whole core area be supported, then look at the description below for that program. Thanks so much for watching, and I'll see you again in another video.